Peritoneal dialysis catheter care plan. The role of a nurse in the insertion of peritoneal dialysis is crucial as this is a life-maintaining therapy. Goal of a nurse is to be able to work effectively in handling peritoneal dialysis patients from pre-catheter insertion to post-catheter insertion care. So what is peritoneal dialysis? It is the use of peritoneal membrane to remove fluid, to restore balance of blood chemistries, and to filter waste products. It is an exchange of solutes between blood and fluid across the peritoneal membrane. The cycle is defined as the infusion, dwell, and drainage of dialysis solution. The cycle is repeated through the course of dialysis. Peritoneal dialysis has different modalities: continuous ambulatory peritoneal dialysis, nightly intermittent peritoneal dialysis, and the continuous cycling peritoneal dialysis. Continuous cycling peritoneal dialysis is chosen modality. This is an automatic cycling of exchange overnight with a long daytime dwell. It has 4 to 5 exchanges per night of 2 to 3 liters each and leaving new solution in the patient all day for continuous dialysis. The rationale for choosing has a simple setup and operation using a small portable machine. It is adaptable to patient's home environment or for travel. Patient has greater daytime freedom, and it is definitely suited to the patient who still manage to work at daytime. Less hassle, and patient will be able to cope up with daily routine without the worry of doing dialysate exchange during the day. Patients on CCPD had significantly lower peritonitis rate compared to continuous ambulatory peritoneal dialysis. Swan neck catheter is chosen as swan neck catheters are associated with a decreased incidence of catheter migration and cuff extrusion. Catheter survivor is also somewhat improved. Catheter materials used are made of silicone. Silicone had shown reduced protein loss and less irritation to nearby tissue than what was seen with other catheter materials. Silicone rubber is the most frequently used plastics. Advantages is the relative biocompatibility and lack of trauma to surrounding tissue and minimal leaching of plasticizer. Swan neck catheter is better choice than the straight Tenkov because the curl at the end reduces the risk of touching other organs that causing blockades. The swan neck catheter employs a preformed 180 degrees angle designed to keep the internal portion and external portion from migrating out of position and decrease stress on exit side, which often occurs when a straight catheter is used. Lesser dialysis solution leakage, and because of the curved tunnel, the catheters are specific for the right or the left side. Swan neck catheter advantage: the incidence of exit site infections may be reduced. Disadvantages: it can only be inserted surgically and less commonly available, so can only be inserted by specialized personnel. Pre-operative preparation for peritoneal catheter insertion. So ensure that patient requires the catheter and that he/she understands the principle of catheter care. Obtain consent for the procedure. Patient should bath using an antiseptic soap and discuss with patient where he or she would like the exit site placed. Avoid belt line trousers. It should be easily accessible for the patient to care for the exit site. The exit site should not be under abdominal overhang in obese patients. Mark exit site with indelible ink with patient sitting. Take the baseline weight and vital signs. Administer preoperative sedative narcotic as ordered. Postoperative care of the patient. Goals of post-insertion care is to prevent colonization during the early healing period 2 to 3 weeks and to reduce bacteria at the exit during later healing, to minimize catheter movements to prevent trauma to the exit and cups, to promptly diagnose complication. So the principles of post-implantation care procedures is to restrict postoperative dressing changes to trained staff. Frequent dressing changes during the first 2 weeks are not necessary unless dressings are wet, and frequent dressing changes decrease the risk of contamination and minimize catheter manipulation and subsequent trauma. Aseptic technique using both mask and gloves is required. Mild non-irritating agents should be used to clean the exit and surrounding skin. Strong oxidizing agents such as povidone, iodine, and hydrogen peroxide should not be used as they damage epithelial cells. Sterile water or saline should be used to rinse the exit. The exit should be dried. An absorbent sterile dressing should be placed over the exit site dressing and should not be used alone. The catheter must be mobilized and the exit site should be evaluated at each dressing changes. So in the long-term care of the exit site, so your goals is to prevent exit site infection, to identify problems promptly. The routine exit site care is recommended daily or 3 to 4 times weekly or whenever the exit becomes wet or dirty. Exit care may be done in conjunction with shower or bathing. Showering is preferred if bathing exit site should not be submerged in bath water. So the elements of the most prevalent exit site care procedures including the following: good hand washing prior to exit site care, cleansing agents, the antibacterial soap, pure soap, liquid soap, and medical disinfectants are also used. Hydrogen peroxide may be used occasionally to loosen the crust. It is critical that the cleansing agent used by an individual patient is not irritating to his/her skin. So the dressings, a gauze and or transparent semi-permeable dressings are most frequently used. Routine dressings are optional. Dressings are indicated when the exit is likely to become dirty and when the exit site is infected. Dressings may help to secure the catheter, and the catheter or proximal connecting tubing should be secured to avoid tension and traction during procedures, as well as accidental trauma. Devices are available to secure the catheter. So in the patient's point of view, in the peritoneal dialysis modality, patient's experience and patient's conditions are given important consideration. Patient will be presented with different modalities, catheters, comparison, advantages and disadvantages of each modality and catheter, and the patient will have her own type of modality and catheter based on her personal choice according to her lifestyle, condition, and daily routine. Patient will choose according to the accuracy of information provided by nephrologists and the team and kidney facility. Patients that are given accurate and reliable information of peritoneal dialysis has a higher rate in caring for themselves.